This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
Last night we actually had kind of an interesting case. There was a patient who came in with this severe abdominal pain, been kind of smoldering for several weeks, and it's got more severe here. And his CT showed that he had portal vein thrombosis with associated mesenteric ischemia. Pretty legit finding. And so I'm just going to talk about that really quickly because it's kind of a rare thing to see where you both have the portal vein thrombosis, but also the ischemia with it. So if you think about it, we usually think of ischemia as being like, a lack of blood flow to an organ, but you also have to remember that it's also the outflow, and if you block that, it gets all congested and you're still not getting good perfusion of the tissue. I had to do kind of a deep dive on it to look up, causes and appropriate treatments for this. So some of the things that cause portal venous thrombosis are going to be if the patient has underlying cirrhosis, if they have an underlying coagulopathy, if they're taking OCPs, and then sometimes certain cancers. Things that just cause like clotting in general would do it, but then more specifically also if they have cirrhosis, that's a thing to consider. And then the treatments for it, so you're going to give them plenty of fluids and antibiotics to cover for infection. And then just like any other clot, we're going to do heparin. And then sometimes these patients will even require endovascular, treatment. So they might require interventional radiology to go in and revascularize, and ultimately will also require surgical evaluation in case the, bowel ends up dying. So either way, just kind of like an interesting case. Didn't expect that for this patient, and ultimately got him what he needs. So just one of the kind of more rare abdominal emergencies that we see from time to time. So,
question.
Yeah.
Does it get a different heparin bolus?
I actually asked pharmacy, and they said no, it's the same as just like regular DBT kind of dosing. So, good question. Any other questions? All right, right on.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.